I'll start from myself very briefly, and I decided I'll spare you from this lecture on how big of an investment opportunity longevity is. For the reason of you probably are familiar with it anyway. This is why you're here, right? So you acknowledge it. So instead, I actually thought I'd give you a very pragmatic rundown of how the longevity landscape and longevity investments are actually looking through the lens of an early stage investor, which we are. So my name is Sergey. I'm certainly not alone in our fund. I'm one of the three co-founders and managing partners of LongeVC. So LongeVC is an early stage investment vehicle. We're headquartered in EU, although our team is very decentralized. So we're all the way from Berkeley to Germany and Latvia pretty much. We're a 35 million euro early stage investment vehicle, and most of our focus is in the preclinical stages of therapeutic companies and seed to early A stages of non-therapeutic companies, so all of your early diagnostics. Now, LongeVC has been, and this is sort of a very quick rundown on the people behind. So LongeVC has been co-founded by three managing partners, three co-founders, Gary, myself, and Ilya. We're a very interesting bunch here. So we all pack very different backgrounds of how we actually ended up in longevity investment space in general. So Gary has been leading sort of our team before we actually launched the fund with very early investments, seed investments of ours, one of which is actually in silico medicine. So Alex Javaronkov here, the co-founder and CEO of in silico medicine, which is now the #1 unicorn in AI for drug discovery, as we speak, is actually one of the very first pre-seed investments of the team behind the fund, and which was led by Gary. So Alex is also chairing our advisory board in the fund. So this is how our longevity journey started as investors, from the actual investment in silico medicine. The other interesting deals with it afterwards include the company which is called BasePause, for example, and that traces back to what Phil referred to as animal longevity. So BasePause was recently sold to Zoetis, and that is the company that started off with DNA sequencing, so genetic sequencing for pets, to identify very specific health risks along the way, or specific genetic mutations that would trigger these health risks. So this is how we ended up in the longevity space as a bunch. And Ilya here, for example, has been a banker for 15 years. He abandoned his job, started to invest in longevity, and this is how we ended up as a team. Now we're also joined by a fairly prominent advisory board here in the fund. Again, includes Alex and sort of Mike Levitt, for example, or likes of Miro Venturi, who actually led the acquisition of Foundation Medicine for Roche back in the days. He's now a CEO of Roche PRED, which is pretty much all the new drug R&D for Roche. So we are fortunate. The point here is, we were fortunate to know all these people and splendid individuals in their own right. Sometimes before they became famous in the longevity space. And then sometimes because we worked with them in our previous companies and the ventures we've built before. Now, as a VC though, and this is where my talk gets pragmatic, as a VC, we do not invest in life extension. This is very important to grasp. What we invest in is in prolonging what we call healthy human performance. And there are several reasons why this is actually happening, and you'll see it in the upcoming slides, like what does it actually mean in terms of our actual focus. Now, the first big reason is, before pitching flying to other worlds or other planets, you might as well figure out how to build a launch pad and how to build a rocket that will take you there, right? So pitching the big vision without being able to acknowledge and solve the problems that you have today. These problems are mostly age-related diseases. Kind of makes little sense to us as a venture fund. Now, the second big reason is our own experience with age-related diseases. And this is where it gets personal for the founders, because all of the founders, all three of us, have, in one way or another, experienced age-related diseases, either with ourselves or with our direct relatives. So Gary here, for example, has been for the last 10 years combating cancer, Parkinson's, and Alzheimer's in his family, right? Which when you see it in your own eyes, it's something really different, and I'm sure a lot of people in the audience know what I'm talking about. Something really different from when you read about it. Myself, so I'm 30 years old, which is not very old, but at the age of 27, I ended up in a hospital without the ability to walk. And this is where I sort of figured out that I, won the lottery of having a very rare neurodegenerative condition. So for a very brief moment of time, I have ended up where we will all end up with the loss of function after our 80s, 90s, etc. And it's a very bad place to be. It pretty much sucks to be there, right? And this is something, it hits different when you experienced it. So I've tried to sort of break it down for you of how we look at longevity investments in general. Now, first is to manage expectations and define returns. Now, what I think is very crucial to understand here is that we're talking about sort of three frontiers of engagement when we're talking about longevity investments in general. The first one is what's happening now. So happening now is all of your expanded screening, what is already available. AI-aided diagnostics, radiology is a great example of that. Basic supplements, wearables, aging clocks, all of the self-awareness, all the Apple Watches, Garmin's, Fitbits that you're now wearing, right? So all of these data-intensive potential interventions that you can exercise based on the data that these devices give you or these advanced testing methods give you. All of this is longevity happening now. This is your self-awareness. We're becoming self-aware. We're becoming more interested in essentially, life extension and tackling these risks. Now, the second horizon is the early stage VC horizon. So this is where we look at 3 to 10 years from market. We look at therapeutics and preclinics, where vast majority is still age-related disease focused, right? So we're looking at platform technologies, which means that more than one trick ponies, more than one disease application specifically, with a disease modifying effect. So no incremental innovation, the disease modifying effect is key, which in human language basically translates to being able to tackle the cause of the disease rather than some symptomatic improvements, right? So a lot of these are not yet proven clinically, but they're focused, they have solid assumptions, they have sort of the plan of attack in terms of their clinical programs, and they have some sort of reasonable hypothesis behind the mechanism of action. Now, this is the turf where the early stage VC actually sort of focuses. Now, the third pillar is visionary fundamental science, as I've called it here. You can call it whatever you want, but realistically, it's 10 plus years from market, right? Great to have technologies, but still very largely theoretical. These include systematic rejuvenation, reversing telomere attrition, some epigenetic applications, some really sort of broad epigenetic applications, reversing cellular damage, studying general causes of aging, etc. So this is great to have, and we will be there in our generation most probably, but we're not yet there. These are not yet defined as technologies, and there is not much to invest in anyway, right? So this is all fundamental science, very much the turf of non-equity funding sometimes, right, so the grants. Now, I also thought that I might as well give you, because there are a lot of investors in the audience, so I might as well give you examples of what I consider. Now, let me just check the time here so I don't overburden you for more than 20 minutes. What is exciting in terms of the actual examples of the companies that we have been looking at in various disease areas. Now, us as a fund, as LongeVC, we are looking at two major pillars, which is therapeutics and, well, non-therapeutics. Therapeutics are drugs, non-therapeutics are everything that is not drugs, early diagnostics, AI for drug discovery, and so forth. Now, with therapeutics, this is where things get really interesting, because you can look at a lot of technologies, you can look at a basket of them. Now, we find our utmost excitement in several areas in therapeutics, right? So the first one is immuno-oncology. And immuno-oncology we find to be the next big thing after the existing oncology treatment regimens, which are questionable in efficacy, to say the most, right? But this is where you get a lot of branches, even within this specific field, which is immuno-oncology, and which is triggering your immune response to essentially fight cancer cells, right? So not throwing in another dose of chemo, but rather triggering your immune system, which is capable of fighting cancer cells, but it's not, because it's suppressed, or cancer cells are evading it. So TIL therapies is a good example. So TIL stands for tumor infiltrating lymphocytes, right? So, and that is reinforcing the T cells, which can be allogenic, can be autologous, so can be either taken from elsewhere or taken from the patient, reinforced and injected back. A good example of this is, for example, Control Therapeutics or Tailored Therapeutics. You can Google these companies straight away if you want to. So these, I think, are pretty exciting examples in TIL space right now. Now, the other branch is, of course, IL-27 focused drugs. Surface oncology is a very good example of work in this area. I think it's a very good example. Now, IL-27 is a cytokine that essentially regulates how active your innate and adaptive immune systems are. And that is the cytokine that is sometimes overly abused by tumors in order to suppress the immune system activity altogether, right? So this is how a lot of tumors are actually evading the immune system. So by affecting this cytokine and blocking it, you can actually sort of reinforce the immune system. Anti-PD-1 drugs have hit the market 5 years ago. Anti-PD-1, PD-L1, you might encounter different terminology there. These are now pembrolizumab and nivolumab, right? So the breakthrough drugs that were introduced by Merck and Bristol Myers Squibb. These are now used in melanoma, small cell lung cancer, pretty successfully. So that was a big breakthrough right there. But again, a lot of PD-1 tech still exists in the market in the preclinical phases. Then you have tumor microenvironment research. You have using viral particles to flag tumors. For example, using HPV-like particles to actually exploit their ability to stick to tumor cells, right? And this is how you trigger the immune system response. So all of these technologies in the immuno-oncology space, we find it pretty damn exciting. Now, the other area of interest of ours is, of course, neurodegenerative. Now, with neurodegenerative, you kind of find that the leading hypothesis is still vague, where the leading hypothesis is amyloid, right? So billions of dollars of research poured in. Not a single drug actually demonstrates any sort of efficacy while exploiting the amyloid hypothesis. So there must be something else that causes AZ, for example, or other neurodegenerative conditions. So the bigger room right now, because of this uncertainty around amyloid, is, of course, for the autoimmune hypothesis, right? And that is, for example, a lot of work that is done correlating the presence of the Epstein-Barr virus and the MS, multiple sclerosis, in certain patients, right? And there seemed to be a very strong link between the two. So we might as well hypothesize that it is an autoimmune condition that causes a lot of neurodegenerative effects. So companies that are working on remyelination, such as glycogen, neurogenesis, Alzheimer vaccines, Neurovax, these guys are pretty interesting, still in the amyloid space, but pretty interesting to look at if you want to sort of, get a glimpse of how preventative for Alzheimer's, at least hypothetically, might look like as a therapeutics. Chronic pain management and gene editing for chronic pain management is another non-obvious area. If you are a neurodegenerative patient, which is an age-related condition, pain is your biggest friend and ally because you're actually living with it. Now, companies like Navega, for example, are working on silencing the ion channels to NaV 1.7, sort of so-called channel that regulates the gene that is responsible for feeling pain. And it is studied that people dysregulated with this gene are essentially not feeling pain at all. So you can tackle it in that way. And then you have non-therapeutics, ultra early disease discovery, personalized treatment, pre-comp is a great example, AI for drug discovery, in silico is a great example, et cetera, et cetera. So that being said, that is essentially our very pragmatic focus. Now, our major pillars of attention, of course, are teams, right? It's all about human capital. We spend a lot of our time understanding what are realistic assumptions, what is wishful thinking in these teams. We spent a lot of time understanding how translatable is science. How do you translate base research into, something that is actually actionable? We'll look at short-term focus in terms of what is the beachhead clinical program that the company is going for versus what is the long-term potential, platform potential. And of course the state of IP, right? And the IP was already there as an example. Now, a few examples here. The company we have invested in, TurnBio, right? So mRNA medicines that promote so-called partial epigenetic reprogramming. Very good example of epigenetic reprogramming with a local delivery in ophthalmology. They're actually already close to tackling, or rather reversing, certain cell processes to reverse glaucoma, which is a very good local delivery example. And they're going into, of course, into systemic delivery with more complicated indications. Another good example is Precom Therapeutics, folks from Switzerland, our portfolio company that can grow ex vivo, can grow tumor twins, and are able to very fast test different combinations of therapeutics on the tumor twin of a patient and essentially come back with a personalized treatment regimen for the patient. Vein to vein time, 1 week tops. This is really good. Now, the company round that we're leading right now is, for example, How AI. Now, How AI is a very good consumer part of longevity, where they started off as an SaaS AI engine for skincare and skin aging analysis. They have so far conquered pretty much all the major players in the skincare and beauty industry. So they have contracts with Beiersdorf, with Ulta Beauty, with Nivea, etc. We're now leading their round, 4 million seed round. So if anyone's interested, please talk to me. Now, that being said, fundamental research, as I said, base science is still very much a turf for nonprofits, right? The funding is insufficient. It's very often asymmetric, which means that a lot of early stage research is not getting funded at all because the non-equity funding ends up in big schools, big universities, big research centers. Nevertheless, we've built our own example. We've built Longevity Science Foundation. We've built our own nonprofit that actually now distributes non-equity grants for fundamental science, very early science. So in case you're interested, I'm happy to talk about it as well in the coffee break. Now, the last slide, Phil, and I know you will be sort of rushing me off, is few takeaways from us, again, as a pragmatic early stage investor. A, capable in-house team is a must for your due diligence. You need to have people inside the team. You need to have a powerful advisory board to evaluate this, this tech early. Now, focus is key. There is so much excitement out there, and you can get hyped so easily about longevity tech and all these opportunities around you. They can lose focus. So don't lose focus. Be very pragmatic in how you assess how translatable is science, et cetera, et cetera. Now, the third one, allocations and relationships with research institutions are fundamental. There are so many people with money that want to put this money somewhere. Now, the biggest game in town for an early stage biotech investor is getting allocations in top deals, in most promising deals. You want to get invited as an investor to put money somewhere, right? Because the line with people is sometimes much longer, and with money, it's much longer than there is room in the round. The last but not least, I actually fancy myself, I find excitement in a lot of behavioral economic concepts. And one of my favorite ones that describes the investor behavior in new emerging markets is the tunnel effect. Now, tunnel effect is, I actually have a footnote there, so I'm academically correct here, was articulated by the guy called Albert Hirschman, who's very famous, now deceased, unfortunately, German behavioral economist, who described tunnel effect as the urge to join something when others are benefiting from it, but you're still not really well versed in the topic. And he used this concept to essentially initially describe why revolutions happen in developing societies, because sometimes a developing society that is suffering is looking at the other societies that are not and that are growing, and they're expecting that they will be growing as well at some point of time. But yet what they don't, they try to jump into this train that is seemingly leaving the station and then try to overthrow the government that they have. Very similar thing happens with early stage investors in the areas such as longevity. Do not try to jump in the train because you think that the opportunity is leaving and everyone is capitalizing on it, and you are not, right? It happened to blockchain investors back in the days. Don't let it happen to you in longevity. Rather, embrace the fact that the task of the early stage VCs in longevity is not only multiplying their LP money, it's also educating their LPs, and it's also working together on these common success stories so we can attract more capital and we can essentially present the whole industry as something that is very appealing. At this point, thank you very much. Yeah, I'll be happy to touch upon any of these in the break. Otherwise, thank you. It's an honor to be here.